Mr. President.
Senator from New Hampshire.
Mr. President, I join my colleagues on the floor today to speak in opposition to the nomination of Alex Azar to head the Department of Health and Human Services. Mr. Azar is, I believe, first and foremost, a product of the pharmaceutical industry with a long, consistent track record of sharply increasing drug prices during his tenure at Lilly USA. Furthermore, his nomination makes clear that President Trump didn't mean it when he said repeatedly during the campaign that pharmaceutical companies are, in quotes, getting away with murder, and that he, as president, would dramatically reduce drug prices for seniors and all Americans. Mr. Azar's nomination is yet one more example of the Trump administration putting special interests above the public interest and public safety. Mr. Azar has long opposed any federal intervention in prescription drug pricing, things like allowing Medicare to negotiate for drug prices. And of course, his former company has profited handsomely from the government's handoff approach. When Mr. Azar became president of Lilly USA, he also became chair of its pricing committee, with a major say in price increases for all domestically sold Lilly drugs from 2012 to 2014. During that time, the list and net prices of Lilly's drugs sold in the U.S. increased by double-digit percentages each year. As co-chair of the Senate's Diabetes Caucus, I am especially troubled that during Mr. Azar's time with the company, Lilly more than tripled the price of insulin, jacking up prices from $74 to $269. And much of that increase occurred during Mr. Azar's years as chair of the pricing committee. These price increases are not only exorbitant, but they've caused real hardship to many of the nearly 30 million Americans who are living with diabetes. As candidate Trump would have put it, Lilly, under Mr. Azar's leadership, was getting away with murder. I'm also concerned that Mr. Azar will continue and even ramp up the Trump administration's across-the-board campaign to sabotage our healthcare system. We're now 1 year into this administration's efforts to undermine the Affordable Care Act, and regrettably, it's working. The uninsured rate rose in 2017 by 1.3 percentage points. That's nearly 3.2 million more people without health insurance. Already, the administration has eliminated those payments that allow insurance companies to keep down premiums and reduce copays and deductibles, and that has created further hardship on people who desperately need health insurance. Without reason or justification, the administration cut the open enrollment period by half. It slashed the budget for open enrollment ads on TV, radio, and the internet by 90%, shutting down most efforts to inform consumers about all their enrollment options. And yet, despite these efforts, they weren't successful in dramatically reducing those people who tried to enroll in the Affordable Care Act, because enrollment for 2018 was 8.8 million people compared to 9.2 million the year before. And it shows how desperately people want to have health insurance. But of course, we know that since that enrollment period, the Republican leaders in Congress have used the tax bill to repeal the individual mandate. And meanwhile, in an interview, Mr. Azar spoke of his desire to hasten the Affordable Care Act's demise. He apparently doesn't appreciate that the Affordable Care Act, and Medicaid expansion in particular, has been an absolutely critical tool in the fight against the opioid epidemic. I would urge Mr. Azar and President Trump to read the front page story in Sunday's New York Times. The story is about the devastating consequences of the opioid epidemic in my state of New Hampshire. And the article is titled, "How a Perfect Storm in New Hampshire Has Fueled an Opioid Crisis." And it was accompanied by an even more compelling article titled, "One Son, 4 Overdoses, 6 Hours," that profiled the life of Patrick Griffin of Pembroke, New Hampshire. And in shocking detail, the article documents how Mr. Griffin, who has struggled for years with a substance misuse disorder, overdosed 4 times within a 6-hour period. And twice within those 6 hours, emergency medical responders came to his house and revived him with Narcan, the antidote that reverses opioid overdoses. And, some people reading that article say, well, why can't he just control his substance use disorder? They don't understand that this is a disease. It changes people's brain makeup, the chemistry of an individual's brain, and just like heart disease or diabetes or any other chronic illness, there is a physiology involved with that affects a person's ability to get better. And one of the things that saves people like Patrick when they're overdosing is the drug Narcan, or naloxone, which is the official name. It's been used so much in New Hampshire, most people refer to it as Narcan. And we've seen that the pharmaceutical industry has dramatically increased the price of Narcan. As this epidemic has spread, the price of the drug that's needed by so many to save their lives has increased dramatically. A 2-dose package of Narcan, manufactured by Evzio, cost $690 in 2014. It's $4,500 today. And generic doses of Narcan increased between 95 and 129% since 2012. And bear in mind that it often takes multiple doses to revive people who have overdosed. So this has an impact on our healthcare system. It has an impact in New Hampshire on families, on municipalities, on first responders, all of those people who are trying to save people who have overdosed. Now, as we all know, the opioid epidemic is a nationwide crisis, with some 63,000 Americans killed by drug overdoses in 2016. And New Hampshire has been especially hard hit. The demise of the Affordable Care Act, which Mr. Azar says he wants, would mean that thousands of Granite Staters would lose access to treatment with devastating consequences. And that's true not just in New Hampshire, it's true in states across this country. I think it's unconscionable that a Secretary of Health and Human Services would take away one of our most valuable tools for combating substance use disorders, and that he would actively oppose access to health care for millions of Americans. So, for me, between Mr. Azar's coziness with the pharmaceutical industry, his disdain for the Affordable Care Act, which is the law of the land, and which Mr. Azar would be charged with administering as secretary, I think he's the wrong person to serve in the critically important post of Secretary of Health and Human Services. I intend to vote against his confirmation, and I hope my colleagues will do the same. Thank you, Mr. President.
President.